everyone, Dr. Chalam. I am going to talk to you about the 10 myths that we see with thyroid treatment as well as the thyroid condition. Myth number 1, take your thyroid medication on an empty stomach. What we find with a lot of people is they start taking their thyroid medicines and they actually gain weight because they feel hungry. Now, the reason for that is we think that the thyroid, when it hits the gastric walls, it actually stimulates one of the hormones, the ghrelin, that creates hunger, and you probably actually eat more. So if you're one of those who's struggling with weight gain after being started on a thyroid, try to take your thyroid with food. Now, I have to say, this is not advice. You can talk to your doctor, but be warned, when you take thyroid medications with food, you may need an adjustment of the dose because you may not absorb as much of the thyroid medication. Myth number 2, take your thyroid in the morning, first thing in the morning. Here's something that you need to understand. Some people, the thyroid actually gets absorbed better and works better at night. So you can actually take your thyroid medications just before bedtime. Myth number 3, which is probably more for your physician than for you. You just need levothyroxine or T4. No one needs a T3. Now, let me explain to you what T4 and T3 is very quickly. T4 is your check, T3 is the cash. T4 is given to you, but you have to convert it to cash in your body. And if your body is unable to convert it to cash for various reasons, like the liver is not active, your enzymes are being suppressed by something else, you're going to continue to feel low in your thyroid. So a lot of times we have to add a very tiny dose of T3, which is the active form. So you get to feel better and give more time for the T4 to get converted to the active hormone. The next one, number 4, T3 is useless. Now, if you look in the market, T3, which is the active hormone, is liothyronine or Cytomel, that's the trade name. It comes as 5, 10, and 25 micrograms. In some people, even 5 micrograms is too much. You may need only half of it or even lower. If that's the case, it has to be compounded. So T3 has to be utilized in the right dosage for you to have the best impact. Number 5, this is more for patients who get their information from Google University and so many other patients who say, I can never take synthetic, I just need natural thyroid. And a very common prescription that people use is Armour thyroid, in addition to NP or WP thyroid or a desiccated. It's really from the pig thyroid gland. Now, here's what you need to know. The T4, T3 combination in many of these natural thyroid preparations are a little too much. The T3 is a little too high. So though initially you feel well, after about 3 or 6 months, you start going down. Now, the reason most people don't feel good on a T4 or levothyroxine is because of the additives that the tablet has. Some of these additives actually cause a reaction. The excipients in levothyroxine or the synthetic form is povidone, which is actually a polymer that helps hold the tablet together, and some people react to it. So in the case that you have not been able to tolerate any of your thyroid, especially synthetic, it's good to go to a compounding pharmacy. Now, those of you who take natural thyroid, do trust me when I say this. If your symptoms return, it's actually the combination of the T4 and T3, and you may need to switch over to a synthetic, both T4 and T3, but in the right ratios. Let's go on to number 6. Fibromyalgia is an independent disease from hypothyroidism. So when you go to a doctor and you're giving them fibromyalgia as one of your conditions and hypothyroidism, I want you to understand that the two might be actually connected. In fact, 30% and a little more of patients with hypothyroidism actually struggle with fibromyalgia, and treating one, with the obvious one, the hypothyroidism, actually removes the fibromyalgia. Number 7, most people who have hypothyroidism suffer from motion sickness. Treating the thyroid might actually help you with motion sickness, especially if you travel a lot and you're struggling with motion sickness. Number 8, very important. A high TSH is a terrible thing. You got to take your medicines to suppress or bring the TSH down to normal. The TSH, remember, is thyroid stimulating hormone, which comes from your brain, the pituitary, to stimulate the thyroid gland to produce thyroid. It also does one other important job, converts the T4, remember the check, to cash. When you suppress the TSH, that conversion of T4 to T3 slows down. So taking your medications to have a very low TSH, that means you believe that you have the right amount of thyroid, might actually be the wrong thing. You may be having enough of the T4, but not enough of the T3 because the TSH is not there to help that deiodinase enzyme to convert the T4 to T3, which means you remove one iodine from the T4 to become T3. So remember that it's not good to have a suppressed TSH. Number 9, when you're depressed and you get your thyroid checked because we have to rule out hypothyroidism, the numbers might actually not be very accurate. Let me tell you this. Your TSH might be normal, your T4 might be normal. They may say, okay, you don't have hypothyroidism, you have depression, and put you on an antidepressant. You take the antidepressants, and a lot of these antidepressants prevent the conversion of T4 to T3, the active hormone, the check to the cash. And you actually become more severely hypothyroid, so your depression symptoms come back after a few weeks or sometimes in a few months. So it's important to understand you got to do the whole thyroid panel in order to determine are you truly hypothyroid or not before you get on an antidepressant. Number 10, atrial fibrillation, which is an irregular heartbeat coming from the heart, which can put you at a high risk for blood clots or strokes, is usually associated with hyperthyroidism. In fact, it can be actually hypothyroid, and that may be causing their atrial fibrillation because in the brain, the T4 is getting converted to T3 right in the pituitary, so the TSH may be suppressed, making you believe that they have enough thyroid hormones, but actually in the rest of the body, they don't have enough of the thyroid hormones, so it may be prudent to try a very small dose to help them, and that will keep them in what is called sinus rhythm or the normal heart rhythm. So hopefully these 10 pointers have helped you, and you can think about your thyroid treatment a little differently and ask the right questions. I'm Dr. Chellam, the founder of Holistic and Integrative Center of Novi, the best place for you to find your best doctor. That will always be you.